I want to talk about breast augmentation surgery. Not about the breast implants, not about saline and silicone or which profile, but how do we actually get from this to this? A lot of things for you to know. When you look in the mirror after a shower, what you see is your breast. You see the size, the shape, you see the skin, the nipple, the areola. But as a surgeon, we need to be aware of what's behind what you're seeing. We need to know what's behind the skin. Behind the skin is breast gland tissue, kind of like shown in this image. Behind the breast gland tissue is the pectoralis major muscle, kind of like shown here. Behind the pectoralis major muscle is the chest wall, the ribs, some other muscles. When you go through breast augmentation, you have a couple choices as to where you want your implants in relation to the pectoralis muscle. In the United States today, it's much more common to go behind the muscle than in front, but you can go in front, and I'll demonstrate a little bit about both of those options here in a couple minutes. Another thing we need to be aware of is you do have choices as to where the incision is made. We can either make an incision beneath the breast, kind of like shown in the green line here. That's a technique I use in almost every case, but there are a couple other options. Another option is in the armpit, kind of like shown with the green line here. There are some surgeons who use that. It's a good option if you choose a surgeon who does that operation a lot. Another option is make an incision along the bottom of the areola. That option used to be pretty popular. It's not done nearly as much today as it had been in the past. There are a few more risks with that option, so not many surgeons use that one real commonly. Once we make that incision, we then create a pocket. And we'd either make that pocket in front of the pectoralis muscle and behind the breast gland tissue, kind of like shown here, or we would make that pocket behind the gland tissue and behind the pectoralis major muscle, kind of like shown here. And when we make that incision and make that pocket behind the pectoralis major muscle, most of the time the very bottom of that muscle is divided, kind of like shown by this green line. We do that to allow a little more stretching in the lower part of the breast. Sometimes if you don't divide that muscle, the implant can end up looking too high in the breast. When we do breast augmentation, we can either put the implant in front of the muscle, kind of like shown here, or we can put it behind the muscle, kind of like shown here, having divided the lower part of the muscle to allow for a little more stretching. That's basically breast augmentation. That is how we typically get from here to here. Every woman has her own desires, her own findings. Every surgeon has his or her way of doing breast augmentation. These are just general concepts, things you should be aware of when you choose to undergo breast augmentation. If you've been thinking about breast augmentation, we would love to see you here in our office. In Fort Worth, keeping it beautiful, I'm Kelly Kunkel.